Good day, and welcome to the Foundation for a Healthy Kentucky Youth Data Conference Call. Today's conference is being recorded. At this time, I would like to turn the conference over to Rochelle Seeger. Please go ahead, Rochelle.
Good afternoon. This is Rochelle. I'm with the Foundation for Healthy Kentucky. I'm so glad all of you have joined us today. We have a great turnout for this presentation, and I'm thrilled to have two great speakers who know their data on Kentucky's youth. Again, Rochelle Seeger. I work at the Foundation for a Healthy Kentucky as a Community Health Research Officer, and I do a couple things here. I work on the annual Kentucky Health Issues Poll, and I work on Kentucky Health Tracks, the data website that the Foundation has put up. And I also work on doing this training series called Health for a Change to get information out into our nonprofit communities, all of whom are working to improve the health of Kentuckians. The Foundation sponsors this training series, so we offer these events free to all of you, and I'm thrilled that you're able to join us today. As our operator told us, this webinar will be recorded and will also make available in the next day or so the full slide decks from our speakers today. So don't worry, you'll have all of that available to you later this week. The Foundation for Healthy Kentucky's mission is to address the unmet health care needs of Kentuckians, and we do that by four main strategies: developing and influencing health policy, improving access to care, reducing health risks and disparities, and promoting health equity. As I mentioned, I worked on some of the data initiatives, so I'm thrilled to share this webinar on data with all of the data lovers joining us today. You can see the Foundation's website, healthy-ky.org. You're welcome to go to the website and sign up for our newsletter if you're interested in if you aren't already signed up for that. And also you can see reports, Kentucky Health Issues Poll, data briefs, and a lot of different information, including the upcoming events that the Foundation has put on. Before we get started today with our discussion about Kentucky youth data, I wanted to make mention of two recent Foundation events. The first was just held in September. That was the Howard L. Bose Memorial Health Policy Forum. Maybe you attended in September in Lexington. It was on Kentucky's substance use crisis. If you didn't have an opportunity to attend, the agenda and recordings of the keynotes are available on our website. If you click on that Events tab, you'll be able to go to that. Secondly, the Foundation and a steering committee have launched an initiative called the Coalition for a Smoke-Free Tomorrow. That also has a website, smokefreetomorrow.org, where you can check out all of the organizations that are partnering to work on three main goals, one of which is increasing the state cigarette tax in Kentucky to $1 per pack or more. Feel free to check that out, or if you're interested in joining the coalition, you can sign up on the website. Finally, before we get started with our two speakers today, maybe I saw you at the Data Forum. The Data Forum was held in Northern Kentucky in partnership with Interact for Health, the health foundation that serves the greater Cincinnati area. All data, all day. It was a fantastic event, and I wanted to let you all know that the recordings of the speakers and the conference agenda is posted to our website. So it was a really great day. We had great speakers from around Kentucky, Cincinnati, and from the Camden Health Institute. I'm thrilled to have on our webinar today Stephanie Bunge from Kentucky Department of Education, who's a school health consultant, and Teresa McGinney from Reach Evaluation. They'll be talking about the surveys that they work on, and I'm thrilled to have them here today. So right now I want to turn it over to Stephanie. Stephanie, welcome to the call.
Thank you very much. Thanks for having me. As Rochelle said, I'm at the Kentucky Department of Education. I'm part of the coordinated school health team here, and so we work with schools, districts, and schools on health education, physical activity, policies, programs, curriculum, etc. But part of what my job is also as our data collector for our federal grants that we have that fund our program here at the Department of Education. So the two main ones that we have are the Youth Risk Behavior Survey and the School Health Profile Survey. Centers for Disease Control and Prevention, they fund cooperative agreements for states and for some large local education agencies or local school district cities throughout the country to collect the YRBS and School Health Profiles data. We collect the Youth Risk Behavior Survey data during the odd-numbered years, and then during the even-numbered years, we do school health profiles. So we've collected YRBS data back in the spring, and I'm gearing up to start that process for 2018 in January to collect the profiles data. And if by some chance state departments of education decide not to be funded for these data collections, then the State Department of Public Health in the state has the opportunity to apply for these cooperative agreements as well. So that sometimes, depending on where you're at and maybe partners that you have in other states, you'll hear that some departments of ed and some departments of public health collect this data. So we will start with kind of the more popular one, the YRBS, and then we, like I said, we collect that back in the spring. So we just recently received our 2017 data back and had a press release go out at the end of November. So all of our new data is up on our web page, which will be on my last slide. So you'll have direct access to that. But if you aren't familiar with the YRBS, it monitors the 6 categories, the 6 health risk behaviors of youth that is identified by CDC. So it's looking at injuries and violence, tobacco use, alcohol and drug use, physical activity, nutrition, dietary behaviors, sexual risk behaviors as well. States have the opportunity to modify the questionnaire and add some state-specific questions that pertain to what is going on with the youth in their state. So for Kentucky, we have a group of stakeholders that gets together usually in the summer before this process begins for the YRBS, and just decide, what are the main issues, what are we hearing, what do we need to maybe add questions about. So we've done a lot in the past of self-harm, oral health has always been an issue, just different things that come up that we think are kind of hot topics. So we do have the ability to add to the questionnaires themselves. So the YRBS is usually administered to about 50 middle schools across the state and about 60 high schools across the state. Not all states do middle school surveys, but we opt in and do them, so we have some extra data. From those randomly selected schools across the state, it is then administered to about 3 to 5 second period classes in the school. Doesn't always work out that it's second period, but that's kind of the guidance that CDC gives us on how to select those classes. The survey takes about 45 minutes to complete. Passive parental permission is required for students to participate. And then the data and surveys are completely voluntary and anonymous. So no students have the ability to not answer any questions, decide not to take it, and then of course their data, their responses are never made public. We collect the YRBS data actually through a partnership with our Family Resource and Youth Service Centers coordinators. They're the ones that do the data collection. We have a partnership with them that if the school is selected and serviced by a center, then they do have to collect the YRBS, they do have to participate. So it's been a huge partnership for us and really just the main reason that we've been able to get weighted data for so many years. The data can only be reported at the state level. We can't get school, district, or county level data because it's such a small sample of schools and students that actually participate. So we get that question a lot. Can I get my county data? What's my district look like? We don't have that capability through the YRBS. So here I'm going to get into just a few of the YRBS results from 2017. If you, again, go to our website, you can get a multitude of many results and summaries that we have that CDC provides to us from the data, but I wanted to pick out a few key highlights. And this is one. These slides, you'll see they're kind of a different color in the dark blue. They're actually provided to us by CDC, and they are available on our website as well. So please, anyone, feel free and access them, copy, paste them into presentations you want to give, or look them up. They're available for anyone to use. But so this one, looking at the percent of middle school students who have ever tried cigarette smoking, and that includes 1 or 2 puffs. So you're going to see on all questions within the data that it will give you your total percent. So middle school that have ever tried cigarette smoking was 12.1% this year. It will break it down by male and female. also by grade level, and then also by race and ethnicity. And if you get into the actual summary tables and data reports, you can also break that down even a little bit further into their age. So that's another option. So if you go to and then this next slide, you can see that these are some trends that are also reported within the slides. And for us, for this year, this was a huge win, we'll call it, for smoking percentages in middle school students. So this was a statistically significant drop from 2015 at 22.5% to 12.1% in 2017. We were very excited about that, as well as our partners over at the Department for Public Health and the Tobacco Cessation Program. So we were very excited to see this. This next one that I pulled out was percent of middle school students who attended PE classes on one or more days in the week. You'll see that the total was 36.8%, and then again broken down by male, female, grade level. It looks like 6th graders are getting a little bit more of it than 7th and 8th graders. But again, when you go back to the trends, this was not a positive trend that we saw in a decrease. So from 2015 at about 50% to 2017 at 36%. So this was definitely cause for concern for us that we will be looking into and seeing what can be done, especially as it relates to the new work of accountability in Kentucky schools that will be coming forth with a new accountability system. So this was not a very positive one, but again, there was a significant change from 2015 to 2017. Oh, I think, sorry about that. Let me go back one. This was from the high school data that we have from 2017 for those students who currently use an electronic vapor product. That was at 14.1%, broken down by, again, the female males, and then it looks like the seniors actually have a higher participation rate with this one. But on a positive note for this one as well, there was a significant decrease in those that currently use electronic vapor products. And when we say currently, that means at least once within the past 30 days. That's what CDC classifies as current. So this was another decrease in the tobacco field, so 23.4% in 2015 down to 14.1% in 2017. So this was another big win for us. And there was also a decrease in this product, in e-vapor product usage among middle school students as well. So we were very excited about that. Another high school data point is those who ate fruit or drank 100% fruit juice on one or more times per day. 48.3% was the total, and this was actually a significant decrease. It doesn't look too bad, but statistically speaking, it was a significant decrease from 2015 to 2014. So as our press release showed, we had a lot of really positive things, especially related to tobacco, for significant trends decreases from 2015. Some not so good ones when it comes to vegetable and fruit intake for high school students, and then the amount of PE that middle school students are getting. So that was where a majority of our trends made it, well, there was a change from 2015 to 2017. And then some of the other contents or areas that the YRBS looks at, pretty much everything stayed the same. There weren't any significant changes. So going on to the next data source that I collect at the Department of Education is called the School Health Profiles. This is usually a little less known. We call it profiles for short. This monitors and assesses the characteristics and trends in school health education, looking at PE and physical activity, practices relating to bullying, school health policies that the school has, especially as it relates to tobacco prevention. It looks at some data points for school health services, family engagement, and the coordination of school health topics at the school. Profiles is, again, administered during even-numbered years, and it consists of 2 questionnaires. There's one that goes for the principal and then one for the lead health education teacher. There's about 325 schools across the state that are randomly selected to participate, and this is just a middle and high school survey as well. Participation is voluntary, so there's lots of follow-up that has to be done to make sure that we get enough participation to get weighted data for the state. Again, this data can only be reported at the state level because of it just being a sample size of middle and high schools that participate. And then we do get 2 separate reports for this data, one from the principal and then questionnaire, and then one from the teacher questionnaire as well. The principal questionnaire really focuses more on the policies and the programs that are occurring at the school, whereas the Lead Health Education teacher questionnaire focuses more on the curriculum, what content is being taught in the school, and then also what professional development they have received related to any health education content. And this data, while not as widely used, we use it a lot for our programming because we are funded by CDC to provide professional development and technical assistance to schools and districts on many of these topics. So we really do use that data to help guide our work plans that we have. But there's still a lot of really good information for our partners within there. So here's a couple examples. So again, we have 2016 data as the latest since we're getting ready to do this again in 2018. This is percent of schools that follow a policy that mandates a tobacco-free environment, and that includes any and all areas for students, staff, and visitors. So you can see it breaks it down by high schools, middle schools, those classified as junior, senior highs, and then all schools. So we'll look at the last bar on these, the orangish one, which is 37.8% of middle and high schools have a complete tobacco-free policy that they follow. We work a lot with the program over the Department for Public Health to promote 100% tobacco-free schools, and we have over 60 school districts that have a 100% tobacco-free policy in place, which is pretty exciting here. We obviously want to see more, but there's a lot of support for this at the Department of Education as well. Another highlight, so this one looks a little crazier, but this is percent of schools that never, rarely, sometimes, or almost always offer fruits or non-fried vegetables at celebrations. So this is even a topic we get calls about. There's too many celebrations, there's too many birthday parties, things like that, so we can go back and look at least at the middle and high school level. Again, I think a lot of this probably takes place at the elementary level, but we only have data for middle and high. But you can then see it broken down by each of the answer options, and then percent of all schools, of course, in there as well. So it looks like for the majority, that schools sometimes offer fruits and non-fried vegetables at celebrations. Another data point, percent of schools that have a full-time registered nurse who provides health services to students. The total is 54.4%. We hear a lot about this. This is also being brought to the attention within, our new accountability system that's being proposed, looking at chronic absenteeism and the schools that provide nurses. So this will be a good data point for us to have moving forward, and also just a huge piece that schools need to keep their students healthy and in class, and that instruction time can make a huge difference. So again, this is just some of the data that is available through profiles. This is my contact information, my email address. Here's the direct link to the YRBS webpage, and as well as the profiles webpage through our Department of Education website. The website's a little funky, so we always provide direct links, or from the home page, my best advice is to go into that search bar at the top right-hand corner and search for YRBS or school health profiles, and the first option that comes up would be the one that you would want to select. Michelle?
Thanks so much, Stephanie. A few questions, and a reminder to all the participants on the call, you're welcome to chat in our questions. One question, Stephanie, you talked about technical assistance that you're providing. Could you describe a little bit about that and how people could get technical assistance that you provide?
Yeah, sure. Our funding through CDC, one of the main things that we're funded for is technical assistance. So schools and districts will call us for a variety of reasons, and local health departments and community partners, and we can go to the schools and help them. We can attend committee meetings and provide some technical assistance or if there's a specific topic that they're looking at. Let's say a school is working on some recess policies, or a district is looking at improving their local wellness policy. We can come in and provide help and resources to them for whatever the topic may be. So it's more related to the programming as opposed to the data, but that's what we're here for. So we try to provide as much technical assistance as needed, and all they have to do is email us and ask us, and we'll be there.
Excellent. Let's see, there's a question about that decline in the tobacco use, ever use, I think, down to 12%. Can you talk a little bit about that? It's a pretty exciting, significant decline.
Yes, it's very exciting. I think there's not really there's not one reason for it. It's not like the YRBS doesn't ask a why. It's more of a surveillance of the behavior. So we don't have a why, but we know that there's sometimes access is a little bit harder. The cost for students can sometimes be too great. Again, working on policies, changing culture. There's cities that have ordinances. There's just different. I think it's a wide variety of things is my hope. And it was reassuring that we saw the cigarette use and the electronic vapor product decrease. So that I think provided some extra confidence in what we were seeing. But to have a set, a certain answer for why, I don't know. The questions have remained the same. And usually our rates stay pretty similar, as you saw in some of those slides. So I don't know. We're really hopeful and excited, and hopefully in 2019 it remains the same, or some will go decrease even more.
Great, thank you. And then one additional question. We saw the hot off the presses results for 2017 on the YRBS. When will national data be released, or where can we access that?
Sure. CDC doesn't usually release the national data until the summer of the following year, so usually around June. So June 2018, the national data will be available. So if you go to the CDC website, which I know a lot of people get YRBS data from the CDC website, which obviously makes sense, but they don't post the 2017 data until next summer. So that's why I always direct people to our web page, because at least for our Kentucky data, we have the most current on our website, but the CDC website does not have the most current.
Got it. So June 2018, we'll mark our calendars for that data.
Yes.
Stephanie, one additional question is coming for you, and maybe in the technical assistance you've gone out to communities, you can give some examples of how you've used this data, or maybe some ways that communities could use this data to.
I know a lot of our Family Resource Use Service Center coordinators use this data in grant writing, as well as local health departments. And I think it can also just be a really good source of data to bring attention and awareness to issues of what students are going through, because you hear a lot of things and people talk and make assumptions, but I think really bringing them back to the data can show a real cause and really utilize the data, again, for grant funding, but also some policy change and programs that are needed that they may not be aware of, that students are 20% of high school students have inflicted self-harm on themselves in the past year that may not be aware, or maybe they think that's actually going on a lot more in their community. So again, I think it's just bringing awareness to certain groups of people, agencies, and then hopefully getting some programs in there to help the students.
Very good. Thanks so much. I noted that e-cigarette, that 22% ever use in the 12th graders, that's a similar number that we see on the Kentucky Health Issues Poll, which is a different survey of adults, but about 1 in 4, 25% of adults in Kentucky reported ever using cigarettes. So that makes sense to me. So thanks so much, Stephanie. Stay on the line.
You're welcome.
We may have some time for some additional questions. So participants, please feel free to chat in your questions there to us. And next, I'm thrilled to turn over the call to Teresa McGinney with Reach Evaluation. Welcome, Teresa.
Thank you so much. Like Rochelle said, my name is Teresa McGinney. I am an epidemiologist at Reach Evaluation. And REACH Evaluation provides evaluation services to a number of organizations and agencies. And we provide program evaluation, or we serve as evaluators on federal grants or foundation grants and the like. One of our projects is with the Department of Behavioral Health, Developmental, and Intellectual Disabilities with a survey called the Kentucky Incentives for Prevention Survey, or the KIPP survey. So that's what I'm here to talk about today. So what is the KIPP survey? This is an anonymous school-based behavioral health survey, and it's administered every other year in even-numbered years. So it's in the off years of the YRBS. And it's administered to middle and high school students, similar to the YRBS in Kentucky. So every year that we administer the survey, we invite every single school district to participate. We try and make it as easy as possible for them to say yes, but participation is voluntary. There's no cost to the district directly other than their staff time that it takes to administer the survey. So the state Department of Behavioral Health fronts the cost for the printing of the survey and the mailing and all of that type of things. So in general, we've had great success in recruiting school districts to participate. In 2016, we had 149 of the 173 school districts agree to participate. It is important to note when we're looking at some of these data in just a few minutes that Jefferson County and Warren County, which are two of our, Jefferson County is obviously our biggest city in Kentucky, and they have never participated. They've got their own surveys that they administer, and to be fair, especially for Jefferson County, it would be a large undertaking for them to participate. But we're hopeful that we can hopefully get them on board at some point in the future. Fayette County has traditionally participated in the survey, but they did not in 2016. There were some circumstances surrounding that. So for the 2016 sample in particular, this is largely a rural survey. So it's just important to keep that in mind when looking at the results. And when a school district agrees to participate, we invite every single 6th, 8th, 10th, and 12th grader in that school district to participate. So rather than doing a sampling methodology, we do a census. So we invite every single student in those grades to take the survey. And of course, they can opt out. Like Stephanie said, they can skip any questions that make them feel uncomfortable. But we try and get and we typically have a high participation rate for all of those grades as well. So they can opt out and their parents can opt out, and students that are absent or otherwise not present in the classroom that day don't make up the survey or anything like that. But we have typically a very large sample. Every year it has been over 100,000 students, and in 2016 we had a total of 111,000 students and 700 students. So as far as the measures that we actually ask about, this survey was developed as a substance use surveillance survey. And so we've got a number of questions on the survey on alcohol, tobacco, and other drugs. And in 2014, we did a major rehab of the survey and added additional questions about more recent substances that have become more prevalent, including different types of prescription drugs, heroin, e-cigarettes, and synthetic marijuana. And so for all of the substances, we ask about 12-month use as well as past 30-day use. We also ask about related risk factors, so things like the perceived risk of these substances or the perceived parental, peer, and personal disapproval of using these substances. And most of these questions that we have on the survey come from other national surveys, like the Monitoring the Future survey on substance use among youth, or the YRBS that Stephanie was just talking about. So the advantage of using items from other national surveys is that these are usually validated instruments, and it also gives us a national comparison point, which is nice so that we can see how Kentucky's use rates compare to other states and the nation. In addition, in recent years, we've kind of expanded the scope because we recognize that there are other things that put youth at risk for using substances that are, other related factors. So there are additional measures on the survey that cover bullying, cyberbullying, other types of peer victimization, as well as other risk behaviors such as getting into fights at school or getting suspended or dealing drugs. We've also added a 6-item mental health scale and 3 questions on whether students have had suicidal thoughts or behaviors. So next, in terms of the actual results that we put out, every district who agrees to participate receives a district report with their results, and those district reports include data on how their district compares to the region and to the state and to the nation for every single measure that we collect data on. We also provide districts with a trend report that shows their trends over time by grade for each item on the survey. Those district reports are not publicly available because with every district that agrees to participate, we sign a confidentiality agreement with them, so that that confidentiality agreement says that we won't release their data without their permission. And that's primarily in place because we don't want to discourage districts from participating because they're afraid they will be, they'll have the highest heroin rate across the state. And also because district report or district level data tend to be less reliable in terms of the just the sample size, because districts will be smaller. So the more reliable data are at the regional or the statewide level. But that being said, there are ways to get district level data if you need them. Many coalitions, you really just have to talk to the superintendent, and we at REACH are happy to facilitate that process if needed. So, but we do put out regional reports, and I'll show you a little snapshot of that in just a minute. And that provides maps on not every measure, but key measures, as well as a statewide trends report that looks at every single measure in the survey and the trends for that measure over time. And then lastly, in recent years, we've really tried to make the data, we're very fortunate to have such a rich data source with a huge sample size in Kentucky, and so we want these data to be used. And so we've tried to put out some tools to help community folks and policy level people, digest and share these data more easily. So I'll go through some of those resources that we've put out at the end of this presentation. So now we can look at just kind of a sneak peek of some of the results. And so this first one is from our statewide trends reports, and this shows the 30-day alcohol use by grade. And so you can see, let's see, try and do this little arrow. So you can see here's grade 6, 8, 10th, and 12th. And I'm sure you can't read these numbers. I can't either. But the yellow bar is 2004, and the blue bar is 2016. So you can see across all grades, we see a decline, which is in line with what we're seeing nationally as well. So here's an excerpt from the regional report where we show on a map the regions that have higher usage rates of alcohol in the past 30 days. For the regional reports, because we're comparing between regions, we want to kind of control for the natural variation that occurs between grades. So we just pick one grade, and so we typically report on 10th graders. So for example, here we can see that Four Rivers in the westernmost part of the state has 23% of their students reported, their 10th grade students reported using alcohol in the past 30 days. And then again, up at the top here, you can see this trend report, and the blue line is Kentucky, and the red line is the U.S. So you can see we're pretty close to the U.S. average, but typically a little bit below it. And then the next slide shows the actual regions, the trends within each region. And so you can see, and of course on the actual report you can zoom in if you're looking on it electronically, or you can see it much more clear on the paper copy so that you can see the actual trends for each region. So again, I'll walk through it with one more example. Here is past year cigarette use broken down by grade, and you can see the downward trends across each grade, which is in line again with what Stephanie was seeing in their YRBS data. And here is the past 30-day use of cigarettes across the state. And again, up in the top, you can see the national trend in the red line, and as we all know, Kentucky has a higher smoking rate, both among adults and among youth, than the national rate. But both are declining, which is good. So again, here are the regional trends that give you just a deeper snapshot into what's happening on a local level throughout the state. I wanted to give a few more highlights of the data because, with relevant topics. So the first that I've shown to display is 30-day heroin use. As we all know, that there's a heroin epidemic in Kentucky. And what I wanted to point out is that all of these percentages across all 4 grades, though these bars might look big, they're all less than 1%, the highest being 0.6%. So we have very low usage rates of heroin among Kentucky youth, thankfully. And it matches what we see in the literature of the and additional data sources, that the highest prevalence rate of heroin use is among 18 to 25-year-olds especially, rather than among, school-aged youth. But even with these small percentages, we did see declines between 2014 and 2016. Here were some other new measures that we added to the survey in 2014, and these were parallel with the YRBS. And so, as I mentioned, the YRBS is administered in the off years of the KIP. So we've presented the data on this graph like that. So past year bullying at school, our data are pretty much in line with the YRBS national data, and they didn't really change from 2014 to 2016. But it is, a little under a quarter of students, of 10th grade students, said that they were bullied at school in the past year. Cyberbullying has shown slight increases both nationally and in Kentucky. Serious psychological distress. This is the 6-item mental health scale that I mentioned, and this has shown a little bit of an increase over the past few years. Suicide attempt in the past year. Nationally, there has been a little bit of an increase in the self-reported suicide attempt. In Kentucky's data, in the KIP data, we did not see this increase. And then lastly, one measure that we have noticed an increase in is carrying a handgun. I want to clarify that this is not carrying a handgun to school. We have a separate question for this, and it has always stayed below 1%, and it has not shown any type of increase at all. Carrying a handgun, on the other hand, has shown an increase, and these are all statistically significant. And I view this measure as more of a proxy for how many households have handguns in them. But regardless, it looks like youth have more access to a handgun in recent years. So next, real quick, I just wanted to show you a few resources The first is this KIPP data dashboard, and I'm going to try and share my screen now. Okay, so here is our KIPP data dashboard, and you'll see, so the default, when you pull it up, the default will show all regions and 2016, which is the most recent year of data that we've got. It'll show the total number of students who took the survey, the grade and gender breakdown, and then key data points that you can reference. So for example, nearly 45,000 students think that drug use is a problem at their school. 32,000 said that they were bullied in the past year, and nearly 7,000 students attempted suicide in the past year. There are other data on here including substance use rates, alcohol, smoking, and marijuana. And this all, if you need to print it out, this will print very nicely onto a one-page, 8.5 by 11. So at the top, if you want to look at previous years of data, you can do that, and the numbers will change. There are some data like bullying and cyberbullying we added to the survey in 2014, so we don't have data for years prior to that. So again, if you want to filter by region, you can also do that in this drop-down menu in the top left. And you can just click the region, and then the numbers will shift to show that region's data. And again, you can go back and look at previous years, etc. The next link on that last slide that I wanted to show you is called the KIPP Data Visualizer. And when you click that link, you'll be brought to this introduction page that shows the map and gives kind of an introduction to the KIPP survey and to this tool. So if you click the different tabs, this first one says 30-day substance use, 30-day smoking, etc. This tool is a little bit more interactive. So here you can this shows the trends of 30-day substance use for cigarettes, smokeless tobacco, alcohol, and marijuana, and it shows the by year at the bottom. The default, again, is 10th graders across all of Kentucky and both genders, but you can filter if you want to only look at females or if you want to only look at the bluegrass region. You can do all of that. So I also want to point out that on this, in this tool, some of these tabs have a lot of lines on them, and if you have trouble reading, you can click the line that you're interested in, and it will gray out the rest, which is useful. So just as another example, I'll just show you this bullying tab. So we've got some of these have different layouts. But the bullying tab, for example, you can see that in Kentucky in 2016, among 10th graders and both genders, about 23% of students said that they had been bullied on school property in the past year. So this is just you're welcome to explore it, and feel free to email me if you've got any questions about anything on this website. The last link on my slide is just our information page on the KIPP on Reach Evaluation's website. And this is where that link will take you. And so here there's just a little bit of an introduction about the survey that I've kind of gone over. And then in this green box, this is where you can download all of our reports. And so this first one in this box is our state and regional data report. That's the one with the maps. And the second one is the statewide trend report. That's the one with all of the bar graphs for every single item on the survey. And then if you need previous year's reports, then you can find them there as well. So that's all I've got, and I'm happy to take questions now.
Teresa, thanks. That was great. One question is about the full question wording. Can we find that on your website?
Yes. Actually, that's a good question. I think it's in a different it's on a different tab than what I've provided. I'm happy to email it out, or I can email the link to the other tab out if that'd be helpful. But yes, we do have. Yeah, we can share the entire survey instrument.
Great. You mentioned that for 2016 there were over 111,000 students surveyed across the state of Kentucky, and that excluded Jefferson and Fayette County. So what percentage of the total students in Kentucky does the KIPP student survey represent?
That's a good question, and I don't know off the top of my head. I know that if we had, I think that Jefferson County, if we did Jefferson County as we do the rest, I think it would about double the total population. So not including Fayette is, a little bit more, so it's probably a little less than half of the students. It's my rough guess, but I can get back to you with a more concrete answer.
Great. We have some additional questions for you. So you said it depended on the school district on whether those survey results would be released. Can someone find out whether or not their district participated in KIPP?
Yes, that's a great question. So in the reports that I've shown, and that you can download in that green box from the link on our website, we list all of the districts that did participate, and so and we list them by county so that you can see whether your district participated or not. And if you're interested in, a lot of times people will ask us, how can I get my district to participate? Which is a great question, and we would love to talk to you about that. My colleague Lisa at REACH is the one who coordinates the KIPP effort at REACH's end. So typically it's just a conversation with the superintendent in terms of getting data from district level data. And that would be kind of the process that we would need to go through. If there's a district that you'd like to participate, if you have a relationship with the superintendent, then we'd love for you to kind of plant that seed with them and then connect them to either myself or Lisa at REACH. And we're happy to kind of continue that conversation together.
Great. And so the other side of that, so if I look and I see that my school district has participated and I'm interested in a specific topic, I can contact you and you can help me negotiate that with the school district to maybe with the permissions and things like that we would need.
Definitely, yes. And I should say that most of the time the superintendents are very willing to share data. They do it all the time with coalitions and for grant writing and that type of thing. So there's definitely a willingness to share data.
Excellent. Some final thoughts, Teresa and Stephanie, on some best practices that you all see how your data is used, some best practices, or if you have any worst case scenarios, you can start that off. And for me, the two that come to mind are, one, cite the source. So I love to see the citations for any data source that's being used. That way someone can quickly verify the number that I pulled for my presentation is correct. And it also helps me in the future if I have to update the data when the next year becomes available of YRBS or KIPP. I can easily do that because I know the data source. And then the second one is what Teresa and Stephanie both mentioned on our call is to reach out to the person who's working on the survey and get questions answered about how to use the data or anything like that. So those are my two recommendations. Do you, Teresa, have ideas on some best practices or ways you've seen KIPP student data used effectively in Kentucky?
Sure, yeah. Well, just another point that I like to always mention, if you're trying to compare, sometimes we do try and compare the KIPP data to another data source, for example, another U.S. survey. And something to note is that even when there's like a very slight change in the question, so if the question isn't worded exactly the same on a national survey that it is as we have it on the KIPP, there can be pretty wide variation in terms of the percentages that you'll you'll find. So just keep that in mind, that the best practice is to use the exact same worded question to compare if you're comparing across geographies or across time or whatever. So even between the KIPP and the YRBS, we'll have some variation if we didn't pull the question exactly from them. So that was one thing I wanted to mention. And then also just keep in mind, the natural, like if you're trying to compare between two regions, it's important, like I mentioned, that we choose one grade to look at so that we can kind of control for that natural variation that occurs between ages. So that's something else to keep in mind.
Great point. Stephanie, did you have any last thoughts on some best practices on how you see the profiles or the YRBS being used?
I think it goes back to exactly what Teresa just commented on, was just really looking at the wording of how the data is asked and presented, because it can be a little bit tricky when you're trying to just make it sound better. Then it kind of does change the meaning. So it's really just looking at those data points and making sure you understand completely what it means. So sometimes in the past 30 days or the past year or things like that, it's just important to pay attention to those things.
Great. Thank you, Stephanie and Teresa, both for being on our webinar today. And again, as I mentioned, we'll make this PowerPoint and recording available to all of the participants on the Foundation for a Healthy Kentucky's website. I'd be remiss if we didn't have if we had a webinar on youth data and we didn't mention Kentucky Youth Advocates' work with their Kentucky Kids Count Data Project. That is a great resource page. We invited them, but they, as you may know, are having a big release on their Blueprint for Kentucky today, so they were not available. But that's another great resource for all of us to use that has different data collected by county on Kentucky kids. Next up, I want to let you know that the website that I work on, KentuckyHealthFacts.org, has a resource page with a lot of different websites and data sources available for Kentucky. And if you look down under the health outcomes, you'll see this item, Kentucky Department for Public Health Surveillance and Health Data. That'll link to the Kentucky Department for Public Health's website. And they have a great resource guide that lists a lot of different data resources in the state of Kentucky. The Kentucky Health Issues Poll is listed, the KIPP Student Survey, the YRBS are all listed there, among a lot of other health data for Kentucky. They are currently updating that, so soon you will see the release of the 2017 Data Resource Guide. So just keep a note to keep that on your radar, a great resource to use for us. Finally, thanks to each of you for being on the webinar today. I welcome your questions. Also, I invite you to please complete our post-event survey. I will send that out to you via email this afternoon. Let us know what you liked about the webinar, your recommendaans for future Health for a Change trainings like this one, so that we can bring you information that you need to do your job on improving the health of Kentuckians. Finally, you see the Foundation for Healthy Kentucky's website, KentuckyHealthFacts.org, our Twitter and Facebook. Thank you, each of you, for joining us today on the webinar. I look forward to seeing your responses in the post-survey data. Feel free to contact me if I can be of help with anything. Have a great afternoon.